All right, let's get back into it. We left off on side 57, I believe, with some other antiviral medications. Let's make this bigger so it's easier to see. There we go. So here's a list of other antiviral drugs. The first one we have is Docosanol. Most people are familiar with this or recognize it by the brand name Abreva. So it's an over-the-counter medication that you guys may or may not have personal experience with. I'm not trying to call anybody out or whatever, but it is pretty popular over-the-counter treatment. I mean, as far as the pharmacy goes, we get questions for this a lot. Most of it is over-the-counter. Sometimes we keep it in the pharmacy behind the counter. Just kind of depends on the setup. But this is used for cold sores or fever blisters, which is basically it's a herpes simplex of the face or lips. But usually lay public, they describe it as cold sore, fever blister. And it's a couple notes on it. It shouldn't be used in children less than 12 years old. So it is considered for adults only, even though it is over the counter. And then just as far as adverse reactions go, you notice I don't have anything listed here. It's just hypersensitivity you have to be worried about with this. And it may be because it is topical, some skin irritation, etc. But it's just if that's the only really concern with as far as adverse reactions go. The other thing to take into consideration too, or recommendations for your patients, is that, and this is maybe more what I recommend in the pharmacy, but a patient shouldn't use this for more than 10 days without seeing a healthcare provider. So that's something to ask about and to kind of monitor with your patients too. But that's the textbook kind of recommendation, that it shouldn't be done under you can use it under without medical supervision as long as it's under 10 days. This drug, don't worry about too much. It was actually pulled from the market from the US in 2006, and in the EU it was actually pulled in 2002 above that. And basically it was because it wasn't popular enough, that they weren't selling enough of it or whatever. So this is just here for historical references. You may see some older texts referring to this when talking about treatments for AIDS patients, because this was primarily used with immunocompromised patients who had CMV retinitis. But so you may see it, but don't worry about it as far as testing purposes go. It's just here for historical context, historical purposes. Ribavirin. This one's a little bit interesting. Some different uses depending. They make a systemic form of this and then an inhalation form of this. So, and what I mean by systemic is that they make it PO or they make an oral preparation, and then they make an inhaled version of this. Mechanism of action listed there, but take-home point: inhibits replication of RNA and DNA viruses. So basically, that's what it does. And then for influenza, more specifically for influenza, it inhibits influenza virus RNA polymerase activity and inhibits the initiation and elongation of RNA fragments, resulting in the inhibition of viral protein synthesis. So for influenza, it knocks out the viral protein synthesis, and then for other viruses, it inhibits replication of RNA and DNA. We have a couple of the uses listed there, but it is worth noting that there are a lot of box warnings for this medication, and it's not typically first line. It is something that needs to be reserved for when it needs to, sincerely be used. And so one of the box warnings, for example, is appropriate use. And this is saying that the ribavirin monotherapy is not effective for the treatment of chronic hepatitis C virus infection and should not be used alone for this indication. So you notice here it should not be used alone, but it can be used in combination with some other things. So it needs to be appropriately used. It also has a box warning, and this is related to the adverse effects of the hemolytic anemia. So you notice anemia is listed here, and the it's a big concern as far as the toxicity goes. This hemolytic anemia may actually result in worsening of cardiac disease and lead to fatal and non-fatal MIs, myocardial infarctions, or headaches. And so you're not supposed to treat patients with a history of significant or unstable cardiac disease with ribavirin. So that would be a contraindication. And then also notice too, pregnancy. So it's a pregnancy category X, so it's an absolute contraindication. And there's also a box warning on it. So it's a twofold warning. So I guess they really wanted to drive the point home. Make sure you do not prescribe for pregnant women, and because there are significant teratogenic and or embryological effects that have been demonstrated in animal species exposed to ribavirin. And they also recommend that this is contraindicated in the women who are pregnant and the male partners of women who are pregnant. So it's something that the male patient is affected by as well. And then they recommend, quote, extreme care must be taken to avoid pregnancy during therapy and for 6 months after completion of treatment in women receiving ribavirin therapy and female partners of men who are taking ribavirin therapy. And they recommend at least 2 reliable forms of effective contraceptive must be used during treatment and during the 6-month post-treatment follow-up period. So that's a verbatim quote, and hopefully kind of drives the point home here. Pregnancy category X, definitely something to avoid there. And all of that stuff that I just said was for the oral, the PO, but so the inhalation form has a slightly different adverse effect profile and its uses. So for the inhalation therapy, its only use is for the respiratory syncytial virus, RSV. So please note that it depends on which form of this medication you're talking about. And so for the inhalation form, they only has 1 box warning, and it's for appropriate use. And it states that the use of ribavirin in patients requiring mechanical ventilator assistance should be undertaken only by healthcare providers and support staff familiar with this mode of administration and with the specific ventilator being used. Strict attention must be paid to procedures that have been shown to minimize the accumulation of drug precipitate, which can result in mechanical ventilator dysfunction and associated increase in pulmonary pressures. So take-home point, it is just something that should be used under medical supervision and, probably strict protocols in the hospitals with them. It's also that aerosolized ribavirin is not indicated in the use of adults, which is interesting. And so it's an off-label use if it is used in adults, and it's only used for RSV infections in hematopoietic cell or heart-lung transplant recipients. So only for those transplant recipients in adults, and then pediatrics is for the RSV infection. But I don't know how often you guys will come across this. I haven't come across it much, but that's not saying much. But just note that it's going to depend on if you're having inhaled form or the PO form or the systemic form as far as what it's used for, and then the adverse effects you're concerned with. The other thing that's noteworthy too when it comes to adverse effects, that definitely with the inhaled form you will have more respiratory adverse effects. So for example, increased risk of apnea, bacterial pneumonia, bronchospasms, dyspnea, etc. It doesn't give the frequencies, or they're not listed, but it is something that is a concern. There's also still going to be a concern with the anemia with the inhaled form. It's a rare but serious side effect, but it's not a boxed warning for this medication. This one is interesting in that its brand name kind of lets you know what it does. It's Viroptic, Viroptic. Viroptic, so it has optic in the word. It's like a virus optic, easier to remember, a little bit easier to pronounce other than the Trifluridine. But the only reason I mention that is because that is what it's used for. It's an ophthalmic antiviral agent. So and it's used for herpes, keratoconjunctivitis or keratitis. So it is an eye drop. And then take-home point for mechanism of action is basically it interferes with viral replication. But other than that, it's kind of a niche use. May not see it that much. And like I said, a lot of people refer to it as a brand name, I think because it's easier to remember, easier to say, and then it kind of gives you an idea. So it's Viroptic, Viroptic. Again, not for testing purposes, but I think it's just one of those that will help you memorize it. So hopefully help it kind of stick out. But overall, not super commonly prescribed, and it'll be interesting to see if you guys ever come across this. Summary table. Again, I like these a lot. You've heard me say that a number of times on these recordings, but just drugs, clinical application, adverse effects, contraindications. Please squint at this, look at the details. And by the way, I say squint because my brother's an accountant, and apparently they say that all the time. A lot of my family's an accountant. My dad's an accountant, a lot of grandparents, etc. But my wife always makes fun of me for saying squinting a lot, but definitely. So in accounting world, I guess they say squint at the details, like they're squinting at the numbers, I guess. But anyway, so please squint at these and pay attention to these. Look at these, and like I said, with interferons, don't stress too much about it. Same thing with the HIV drugs, just know how they're categorized. Same thing, some more HIV drugs, but definitely look at those. Look at the contraindications, adverse effects for that table. Switching gears here, going to the anti-parasitic drugs. First off, we're going to start with the anti-malaria drugs. So I just want to take you guys on a little trip really quick to the wonderful world of the CDC. Again, if you're familiar with this website, please just go ahead and fast forward through this part of the presentation. But for those of you who are not, again, the CDC is a great resource for students and for practitioners. We went to an infectious disease doctor before the first time I went to Nepal, and the infectious disease doctor basically just looked everything up, on the CDC website because he wasn't familiar with travelers going over to Nepal or whatever. So this is something that you can go and click here for drugs for prevention, and then I'll pull this up, this yellow book, Traveler's Health, and this will help you determine what type of prophylactic treatment you want to maybe prescribe for your patients if they are going overseas or if they're interested in having malaria prophylactic treatment. It will depend on what part of the world they're traveling to, etc. So for my test and for my class, don't stress about this. Don't worry about this. The details, this is just more for when you're out in practice and you guys can go through that. One thing that I do like, and again, I think will help, is when your students and practitioners, if you go here again to this CDC website, and then on the right hand side they have this quick links section. Click on here, drugs for treatment in the US, and it pulls up this PDF, which is just a couple pages, 3 pages, and it's the guidelines for treatment of malaria in the United States. Last updated 2013, but this is the most current one, recommendations they have. And it starts with the diagnosis over here. So what type of specific species are you hitting? And is it complicated, uncomplicated malaria? Is it severe malaria? It also breaks it down by region, which is important because for the most part, the chloroquine is going to be your drug of choice, your first line, if it works in that area. So unless there's resistance to that medication, so you'll notice here it says the chloroquine resistant or unknown resistance, then you don't start with that drug. But if you go here and if it is chloroquine sensitive, so you notice, oh, shout out Dominican Republic, where my mom's from. Hey, so chloroquine is sensitive in the DR, so that would be first line treatment. And then we'll talk about these drugs a little bit more in detail in the slides, or as far as what you need for testing purposes. So for me, I'm not going to test you guys on the dosing and the regimens, etc. But this may come up in ICM, and they may be testing you on that. I'm not sure. Don't quote me on that. But either way, I think this is good for you guys to know for your rotations. Because of the geographic location in South Texas, you do come across malaria, or it is something. There's a lot of international travelers. Like I mentioned, my mom's from the Dominican Republic. They go back and forth all the time. My wife's family from Nepal. And then you guys probably know a ton of people from Mexico / tons of people from Latin America, etc. But there's people from all over the valley as patients that you guys are going to come across as students, and so it's just the international kind of health, and with a lot of these international infections, it's cool. You get to see them as students. So I know when I was a pharmacy student, some of my classmates were even in bigger cities. We would see stuff down here in the valley that they wouldn't see in some of the bigger cities sometimes. So anyways, this is good, a good table. But again, just for testing, for my test, don't stress about memorizing this, but definitely I think worth looking at and getting to see, what some of the drugs are here. Some of these you'll remember from previous lections. Like you notice doxycycline is making its appearance, tetracycline or clindamycin. So again, a lot of great stuff on the CDC, and it's cdc.gov, by the way. I didn't see the website, but you guys probably know how to find it. And then there we'll have updates. So you notice here updates on kind of the latest outbreaks, etc. And just a lot of good stuff. So depending on when you're practicing, oh look, summer trips, if you guys are taking trips in the summer, etc. And I don't know why they're so happy and laughing, but this is malaria, people. We need to be serious. No, I'm joking. I don't know. Maybe they're just excited that they are wherever they're traveling. Okay, so that's enough of that website. So the first one on the list is the chloroquine. Like I said, usually it's the first line, and that is in sensitive areas. So remember that it's you have to check local resistance, and you have to see if resistance is an area or not. And so with malaria, they say, is it a sensitive area, quote unquote? And you saw that on the CDC website. So first line in sensitive areas. The kinetics, don't worry much about this as far as testing purposes. Just know it is something you can give by mouth, so you don't have to worry about, hooking the person up to IV or whatever. And then this is just, again, kind of FYI, but interesting, it has a very long half-life, and so you are allowed to do once a week dosing. So, and the week dosing is usually for the what is called chemoprophylaxis or malaria prophylactic treatment. And this is where it's a weight-based dosing, so it'll be something like 5 milligrams per kilogram per week, and it's supposed to be taken on the same day each week, which is good and bad in that, for as far as compliance is concerned, as pharmacists, we're interested in compliance a lot because the medication is only as good as as if a person takes it or not. So it's good that it's only once a week, so you have to worry about taking it every day. But then what happens is patients will forget, so it's every Monday maybe, or but then they miss a Monday and then they're maybe off a week or whatever. But so again, kind of good or bad. Make sure that the patients are set some kind of reminder alarm. And everyone has phones nowadays, so they can put some kind of reminder alarm on that. And then if it is prophylactic, they're supposed to start a week or two prior to exposure. So if they're leaving the country, they're going to, Dominican Republic, like I said, it's a sensitive area. They could start the Chloroquine 5 mg per kg, 5 milligrams per kilogram dosing, start a couple weeks before they go, have a good trip, have fun. And then it's supposed to be for 4 weeks after leaving the area. And that's, again, based off the CDC's most current guidelines. So that's where you can get the week dosing. But if you're actually treating it, you will not typically do the week dosing. So it'll be something like you'll do 10 milligrams per kilogram on day 1. Then you'll follow by 5 milligrams per kilogram 6, 24, and 48 hours after the first dose. So it's a little bit different there. And I'd refer you guys to that CDC table that I showed you guys, that PDF. It's good, and it breaks all that down. It has all the dosaging and everything. But for my testing purposes, don't need to worry about dosing. This will just make you, that much more knowledgeable when you come across it in the clinic or whatever. Chloroquine. So as far as its mechanism of action, it's interesting. It's a multi-pronged approach. It does a few different things. So it inhibits DNA and RNA polymerase. It interferes with the metabolism and hemoglobin utilization by the parasites. It also inhibits prostaglandin effects within the parasites. It also raises the internal pH of the parasites, which makes it inhospitable for life, which is also interesting. And then there's a couple things that they aren't sure about, but they think it may interfere with the nucleoprotein synthesis, and they think it also can cause membrane damage in the parasite. But anyway, so unfortunately, I can't really, other than these 3 bullet points, look at those, but it is a multi-pronged approach, and it does a few different things. So just be familiar with these. I think this is kind of as simplistic as it can get, unfortunately. I'm always trying to make it as most kind of concise and distilled for you guys as possible, but unfortunately this is one of those. Don't worry about the 2 that I mentioned that they're not sure about. So don't worry about that causing membrane damage. They're not really sure about that, and don't worry about how it interferes with nucleoprotein synthesis. They're not sure about that either. Resistance is an issue, like with everything. So again, and as far as malaria goes, they talk about it being sensitive or not. So is it a sensitive area? Is it not? And then you'll notice its uses here. Basically, malaria and amoebas. So extraintestinal amoebas, and then plus amoeba and plus malaria, which we talked about there. So as far as adverse effects go, it's a grab bag. There's a lot. If you look at the literature, as far as look at the list of adverse effects, it's a big list, and it may scare some people, especially if they're taking it prophylactically and they're trying to go on a vacation to have a good time, and then you give them this list. I've had this at the pharmacy where someone's excited about going to the Caribbean or something, and then they are going to take this anti-malaria drug, and then they get this medication that has all these super scary adverse effects, like deafness is one, hearing loss, is listed there. So people, don't like that. GI adverse effects can be an issue too. The visual impairment is one that kind of stands out. It's one of those rare but serious, and it actually, it's involved in a contraindication. So if a patient has the presence of retinal or visual field changes of any etiology when used, when they're taking this for prophylactic use, then they're supposed to discontinue it, and it is contraindicated. So it's one of those that you definitely, if they have any visual impairment while taking it, they need to stop taking it. Unless it is for an acute malaria, and unless it is something that they're, you're trying to treat an active malaria infection, that the recommendations are a little bit different on that. And that's something that the CDC website definitely outlines all of that. So when you are actually prescribing this and looking, or, and thinking about using this, definitely look at that. But, and the ringing the ears is related to the hearing loss, and that scares people too. The hearing loss is something I don't like. But then there's GI adverse effects, a lot to list, but nausea, vomiting, diarrhea, etc. Aplastic anemia too is another potential concern. It is on the more rare end, but also things like neutropenia, pancytopenia, thrombocytopenia are potential adverse effects. The agranulocytosis, which is related to hematological, is one of the rare but serious adverse effects as well, and that one is reversible, luckily. So just a lot of adverse effects to think about, but here are the more common ones, and the ones that the one with the visual impairment is related to a contraindication. So so definitely note that. Mefloquine is next. Mechanism of action, again, super distilled for you guys, but it basically destroys asexual form of malaria pathogens. And so this one is used for prophylaxis and treatment. And it's going to depend, again, on the sensitivity resistance. So you'll have to refer to the CDC recommendations on that, please. Adverse effects, interesting here, very interesting. Oh, but before I get into those, I just forgot to mention that. So it's used for the Plasmodium falciparum, this type of malaria, but it's also used for the Plasmodium vivax, VIVAX. So those are the two strains, and again, that's stuff you can find on the CDC website. The reason I was saying that the adverse effects are interesting is because of, well, first you have to be concerned with some CNS effects, so dizziness, seizures, loss of balance, but then the psychiatric effects are interesting, and these actually are related to the box warning. So those are maybe more problematic. And so as far as your common adverse effects, central nervous system, more common, maybe skin rash, some GI adverse effects. But then box warnings are related to psychiatric effects. So definitely read this list here, but it's there's a box warning for neuropsychiatric effects. So they may, and it basically warns this medication may cause neuropsychiatric adverse reactions that can persist after the medication has been discontinued. So because of that, it's actually contraindicated, and there's a box warning that it should not be used it should not be prescribed for patients, for prophylactics in patients with major psychiatric disorders, because it has a neuropsychiatric disorder boxed warning. And if they do use it, so during prophylactic use, if a psychiatric or neurologic symptoms occur, the drug should be discontinued, and then an alternative medication should be substituted. So this is interesting, and kind of note that on this, it's the psychiatric effects are related to the box warning. It's also interesting too, I don't know if anyone listens to podcasts or if they like the This American Life podcast, but they have a really interesting, one of their shows is about, there's an American who traveled to India, and I forget for what reason, but they took this medication for malaria prophylactics, and the person didn't have any psychiatric history or anything, and it was a younger guy, pretty healthy younger guy, and then he ended up, long story short, I guess spoiler alerts, he ended up getting arrested because he had multiple psychotic episodes, and he got arrested in India, and he wasn't making sense. He couldn't, answer questions, etc. So it's definitely something to think about, and that's a pretty entertaining story too, if you guys have time, which I know you don't, but anyways, I thought it was interesting, especially, I guess because I'm a pharmacy nerd, right? That's what we love, stories about drugs. So next we have Primaquine. Take-home point for mechanism of action is that it disrupts mitochondrial and binds to DNA. And of the protozoa, and then specifically for the So specifically for the P. ovale, sorry, there was a typo there, and the P. vivax, it is active against the exo-erythrocytic stages of these two, P. vivax and P. ovale. And then it's also active against the primary exo-erythrocytic stages for the P. falciparum and gametocytes of Plasmodia. So it has a few different mechanisms as far as what it is dealing with, but for testing purposes and for my exam, just remember that it disrupts mitochondrial. It disrupts the mitochondria, and binds to DNA. And its uses, and when we're talking about malaria, in combination with the chloroquine, and then also will depend on what area you're treating and the CDC guidelines as far as its uses. So always remember that with the malaria, and then some off-label uses. So it can be given prophylactically for malaria as considered an off-label use. It's also off-label use for PCP, the pneumocystis pneumonia, in HIV-infected patients. Anyways, and then it's also used for the pneumocystis jirovecii pneumonia, alternative therapy, and that can be in combination with clindamycin. And just a quick note too, so this pneumocystis jirovecii is the same thing as a pneumocystis pneumonia, the PCP, so just kind of depends on what textbook you look at. So it's the PCP in HIV-infected patients, and then maybe in combination with clindamycin. And then the adverse effects here, sorry there was a typo here, but please correct that. They can cause leukopenia, a rare but serious side effect. Related to is the hemolytic anemia, which again is a rare but serious adverse effect. And specifically, if a person has a severe G6PD deficiency, then it is contraindicated. So that's something to watch out for. It's also contraindicated in pregnancy. And then also if they have an NADH methylglobin reductase deficiency, it can increase the risk of hemolytic anemia. And then other than that, more common anorexia, weakness, dizziness, maybe some GI upset as well as far as common adverse effects, abdominal cramps, nausea, vomiting. Another thing that's interesting too, because of this increase, the contraindication, if a person has a G6PD deficiency, then the manufacturer recommends that you screen your patients for the G6PD deficiency prior to initiating the treatment. And I think I've given you guys the definition of G6PD deficiency, but just for completeness sake, or maybe it's in pathophysiology, I get my courses sometimes mixed up, but it stands for the glucose 6-phosphate dehydrogenase, so that's where the G6PD comes from. It is an inherited disorder caused by genetic defect in the red blood cell enzyme G6PD, which generates NADPH and protects red blood cells from oxidative injury. This deficiency, the G6PD deficiency, is the most common enzymatic disorder of red blood cells. And then the severity of the hemolytic anemia is going to vary among individuals with this deficiency. So it's definitely something that, with this drug specifically, you'd want to avoid, and then it's contraindicated, like I said. The other thing too is that so if a person does have this deficiency, then they need to be educated as far as safe and unsafe medications, which this is one of them. Foods as well can also help prevent future episodes of hemolysis. And then something just kind of interesting that I came across that I thought that the geographic distribution is highly correlated with regions in which malaria was once endemic. So there's a hypothesis that the G6PD deficiency may have conferred a selective advantage against infections with P. falciparum, similar to observations with other red blood cell abnormalities. So anyways, I thought that was cool. And then it's an X-linked disorder for you genetic majors out there. But anyways, and so yeah, if you don't stress about any of that stuff, that was just definitions, and then I got distracted because I thought I was interesting. So, but anyways, so that's what that is. Now we have this is a combination medication that comes like this from the manufacturer. It's Atovaquone and proguanil. The brand name is Malarone, Malarone. Just kind of gives it away what it is. That's why a lot of times the brand names are nicer, because they kind of give you an idea of what it is. But Malarone is for malaria. So it's used for the prevention and the treatment. So the prevention of malaria and treatment of acute malaria. Again, going to kind of depend on the area, if it's a sensitive area or not. Mechanism of action is listed there, but it's broken down by drugs, and that's basically as simple as it can get. That the Atovaquone selectively inhibits parasite mitochondrial electron transport, where the proguanil inhibits dihydrofolate reductase. Adverse effects here, most common are going to be basically categorized as GI, as hepatic. So GI, we have things like the abdominal pain, nausea, vomiting, and then hepatic, it can actually increase your serum ALT and AST. So those are those hepatic transaminases that it can, and so the increased liver function test values typically will normalize after about 4 weeks. For that, but that is something to think about, and something that can happen with that. But so basically it's GI and then hepatic are the most common. And because of the hepatic concerns, you just basically need to monitor closely. It's the liver function, and then use with caution in patients with existing hepatic impairment. Unrelated to the adverse effects is the renal impairment. You also use it in caution with patients with pre-existing renal disease. And then it is a medication that you may want to avoid use if the patient's creatinine clearance is less than 30 mils per minute. And it is also contraindicated in prophylactic use in severe renal impairment due to the risk of pancytopenia in patients with severe renal impairment. So there are also some renal concerns you have to think about. So now we have the quinine and quinidine. Historically, these were used more, and again, unlike this one, these don't come together. These are two separate pharmacological products that were used historically more. You can still see them sometimes now. They still are on the CDC website. They still are made, but and then the quinidine specifically, it is also an antiarrhythmic, so we'll see that later when we talk about the antiarrhythmic medications. So that's kind of interesting. But because of this toxicity, so quinine and quinidine toxicity can result in synchronism, which is basically overdose of quinine, because its natural source is cinchona bark, so that's where you get the synchronism. And they have symptoms here: flush, sweaty skin. You guys can read through those. But because of the risk of toxicity, is a reason that they're not used as much. And then a couple notes as far as their box warnings. The quinine has a box warning for nocturnal leg cramps. And so because there was some thought about it being effective for leg cramps, but the box warning the FDA does not recommend its use for that. So quinine used for the treatment or prevention of nocturnal leg cramps may result in serious and life-threatening hematologic reactions, including thrombocytopenia and immune thrombocytopenia. And chronic renal impairment associated with the development of thrombocytopenia purpura has been reported. The risk associated with the quinine use is in the absence of evidence of its effectiveness in the treatment or prevention of nocturnal leg cramps outweighs any potential benefit. So basically, long story short, don't prescribe it for nocturnal leg cramps. It can result in some pretty nasty adverse effects. And then for quinidine, it actually has a box warning for mortality, which is pretty scary. But it shows in many trials of antiarrhythmic therapy for non-life-threatening arrhythmias, active antiarrhythmic therapy has resulted in increased mortality. The risk of active therapy is probably greatest in patients with structural heart disease. So for those of you just tuning in, you might be thinking, why am I talking about antiarrhythmic? But so the quinidine is also used as an antiarrhythmic medication, and that's related to its box warning. But because of the increased risk of mortality, again, another reason. So toxicity, and then the couple of box warnings, adverse effects, etc., are reasons why these have fallen out of favor. Pyrimethamine, mechanism of action, basically summarized at it inhibits parasitic dihydrofolate reductase. It is used for, or it has the potential to be used for malaria prophylaxis. It also can be used for PCP in HIV-affected patients, toxoplasmosis treatment, and then toxoplasmosis in infected patients. So a number of different uses there. Adverse effects, read through those. No box warnings to be concerned with there. So you'll notice these are all hematological potential adverse effects. They are less common, but they are more likely with higher doses. So it is something, if you are going to go up the higher doses with these, you need to be more concerned about. And then they recommend to monitor CBC and platelets twice weekly, in patients that are receiving high dose therapy. And that's usually the higher doses are reserved for the toxoplasmosis treatment. So in those patients, you'd want to monitor CBC and platelets twice weekly. So this is a couple of medications that they do make together. The Artemether and lumefantrine. The brand name is Coartem, so Coartem. Antimalarial agents usually can be used for the treatment of uncomplicated malaria. So again, if it's a sensitive area. So, and not super popular, so don't stress too much about that. Just know that it does come in a combination product. So here is a good summary table again. Chloroquine we started with, usually first line against if it's sensitive, and then you kind of work your way down. Pay attention to adverse effects, contraindications, please. Look at those. And now we're going to more antiparasitic drug. Let's see, we have the other antiprotozoal next. First, we have the metronidazole and tinidazole and metronidazole. Please note these both end in azol, but they are not antifungals, so they are considered, like this chart has, as antiprotozoal or antiparasitic, but specifically antiprotozoal medications. Read through the summary for the mechanism of action, but basically there's an interaction with DNA that causes the loss of that classic helical structure that you guys are probably familiar with, and then it causes strand breaks. So break actually physically breaks down the DNA, and then that inhibits protein synthesis and then causes cell death eventually. The uses, definitely pay attention to those, read through those. Want you guys to know about all those, and also note that it hits aerobic and anaerobic, it's very good at anaerobic infections, anaerobic, not aerobic. So please note that I already talked about how it is usually first line for C. diff or Clostridium difficile. Because it has very good anaerobic coverage. So if you're interested in anaerobic coverage, you typically want to go with something like metronidazole or tinidazole. Also related to the use is that there is a US box warning for both of these medications, and that they both can be potentially carcinogenic. So this has been shown in some animal studies. And so because of that, the FDA has a recommendation that unnecessary use of the drug should be avoided, and it should be reserved for conditions in which the drug is indicated. So basically be mindful about while you're using it, and then make sure that, if there's maybe something else that could be used, for example, for Helicobacter pylori, or, whatever other thing you're trying to treat, that maybe that. Also with that, usually the dosing, so you don't typically put them on this for a long amount of time, usually too. It's usually maybe up to 5 days, depending. So like an amoeba infection, if they have acute dysentery, would be up to 10 days. And then other than that, adverse effects, GI, upset, metallic taste people complain about, and then disulfiram-like effect with alcohol. So I mentioned that before, that's a very violent reaction if you have any alcohol or alcohol-containing products, which include your cough syrups and some desserts maybe, or there's other things that have alcohol in them too, mouthwashes sometimes too. Atovaquone. So the brand name for this is Atovaquone, which I hear more often maybe. This one is used for, they make a topical or preparation, so it's for some dermatological conditions, and then it's also used for intestinal amoebas. So it is sometimes classified as amoebicide. So if you guys are with a dermatologist or maybe outpatient, they may use it for some different things. But anyway, so yeah, those are two big dermatological conditions, and then intestinal amoebas are the two big uses for this. Paromomycin, another medication that can help treat amoebas. So this one, again, not super popular, but it kind of depends on where you end up practicing, but can be used for intestinal amoebas. So for acute and chronic intestinal amoebas. It's not effective, though, for extraintestinal amoebas. And then it's also used for hepatic coma. It's a adjunctive management for the hepatic coma, so you may see it being used for that. Pentamidine, excuse me. I had a cough there for a second. So this is a medication that they make for systemic use. So they have an IM or IV, and then they also have an inhaled oral inhalation use. So you'll notice here that the treatment and prevention of PCP is given by inhalation. Then there's some other uses there. Read through those. But as far as its labeled uses, it only has a labeled use for pneumonia caused by PCP, and then its off-label uses are listed here. As far as adverse effects are concerned, these are the ones you have to be more concerned with. So the nephrotoxicity, renal insufficiency can happen in up to 29% of the patients that are giving this. So an increased serum creatinine up to 24%. So definitely a common and serious adverse effect you have to be worried about. Abnormal liver function tests, a little bit less common. It's about 10% of patients, but still something you have to be concerned with. It can increase liver enzymes. And then the pancreatitis, too, is rare but serious adverse effect. All right, we are going ahead and stop there just for time constraints on my end. I actually have something else scheduled right now. Sorry about that. But so I originally just thought I was going to have 2 parts. Yeah, but we're going to do 3. So stay tuned for part 3 of other antimicrobials. Thank you guys for your time and attention, and feel free, as always, to email me if you have any questions. Talk to you later. Bye.